Hi, I just wanted to take a minute today to get back to a question that Lieutenant Brewer's group had the other day regarding PICO. You know, what if PICO isn't the best question to help you answer the question the clinical question that you have? You know, the PICO format, you know, may be somewhat too constrained on the intervention aspect of it. Say you have X intervention and you're looking at, you know, Y outcome. PICO will help you answer that type of a question. Or if you have an X intervention versus Y intervention on Z outcomes, the PICO format will help you get at these two. You know, and regarding cubital tunnel syndrome, the question they had was actually, you know, what is the best treatment option that you have regarding the treatment of cubital tunnel syndrome or ulnar nerve entrapment, you know, at the elbow. And so the probably a better question in that scenario is actually, what is best practice? And that starts off with, given a particular diagnosis or given a particular condition, you know, what treatment options are available? That is a valid question, and it's actually a very good question, and one that we should be asking, particularly when we're engaged in treating a condition that we're unfamiliar with. You know, and then once we do find out what treatment options are available, how can I choose from a variety of treatment options in determining what would be the best for the patient that's sitting in front of me? And so that brings us to these things here, clinical practice guidelines. Clinical practice guidelines, you know, are condition-specific guidelines. These CPGs are evidence-based guidelines that are very similarly done to a systematic review, but they're somewhat different. We're not going to go into real detail about what CPGs are, you know, in this video. However, many of them will use the ICF model to develop evidence-based treatment guidelines for common musculoskeletal conditions. Things like low back pain, patellofemoral pain, Achilles tendonitis, possibly cubital tunnel syndrome, I'm not sure, but most certainly carpal tunnel syndrome will most likely be in there. One good place to start looking for those is this place called the National Guidelines Clearinghouse. I have this available for you in your Blackboard. There's a link to it, you know, there. And then also the orthopedic physical therapy section has clinical practice guidelines. You know, there, if you browse here, there's a link on there that says clinical practice guidelines, you know, and that can be very helpful, you know, in doing that. And so, you know, when PICO falls apart, ask yourself, hey, what is best practice? And then maybe start off looking for an evidence-based guideline or a clinical practice guideline, okay?